Hi there, this is Thomas Aaron from Fetch Masters Dog Training in Denver, Colorado. And today I am joined by a longtime friend and fellow dog trainer of mine, Michael Curran of Houston Dog Behavior. Um, and we are going to be talking today about aggression. This video is particularly aimed at clients, not so much trainers. Michael has a lot of knowledge, but I want to make sure that we talk about this in a way that helps individuals understand something about how trainers go about treating aggression issues. Also, Fetch Masters, we specialize in high performance obedience, off leash reliability, um, positive hunting dog training, a lot of stuff like that. And we do some, standard behavior issues. And we also work a lot with what we call leash reactivity, or sometimes called leash aggression. But what we don't do is we don't work with any kind of dog on dog or dog on human aggression beyond leash reactivity or leash aggression. And so for those issues, I actually like to refer those types of cases out. And if you have filled out Fetch Masters' contact form and you received back our email saying, we're really sorry, but we don't handle aggression cases, that right there is the guy that I'm going to refer you to, Michael Curran. And so that's why I want to use this video to sort of introduce you to him and kind of introduce the way he thinks about these aggression issues. So, Michael, welcome. If we can just jump right to the chase. My iPad went into screen lock. Let's see. Okay. In our discussions about aggression that we've had in the past and prior to this interview, one of the things that you have brought up is that one of the first thing that you try to do in an aggression situation is to ensure the safety of the humans and other animals involved. Can you tell us a little bit about what sort of safety measures you put in place for maybe some common scenarios?
Well, our top priority is really ensuring safety for humans in the household, visitors, general public, other animals in the household, and general public. So each case is individual. We'll be defining this in the very beginning with a functional assessment. One of the first things we look at is safety and management. So we'll probably be looking at muzzles, barriers like baby gates, X pens, crates. It really depends on the individual case. If it's targeted to a family member or household member versus the general public. So with the general public, we're probably going to want to be looking at auto closing doors. Usually, depending on the level of aggression, we'll want two layers of safety. So if one fails, we do have a backup layer. When we're dealing with intra-household aggression cases, that's even more difficult because we have a second dog that becomes the target. So we're going to be looking at probably a door, a baby gate, and then maybe a visual barrier with that baby gate. It really is dependent on the case.
Okay. All right. So the second thing that we talk about when we discuss aggression is the topic of management. Now, in my experience, when you tell a client that they need to manage any kind of behavior issue, the first thing they wonder is, well, is that it? Do I have to live my life managing the dog, or is there training involved? So can you talk a little bit about what management, what that means, what it is, how we apply it, and how that relates to sort of the training process itself?
Well, really, our goal is not long-term safety and management, but there are cases that do require that because the dog has been practicing the behaviors for so long. It's so ingrained in them. There might be that genetic component where they're kind of broken from the get-go. But in most cases, that is not our end stop. So, really, what I tell most of my clients is we bring your expectations, your knowledge in line with the dog's needs and wants. Then we bring the dog's behavior in line with what's safe and managed, where he's not practicing the behavior. From that middle ground, you guys grow together as a team. So, with this, with the majority of cases, if there's any chance that we're going to hit those long-term goals and growth, we're going to want to manage the behavior, set up the environment, set up the situations for success where they're not practicing, rehearsing, and ritualizing the aggression. They're not meeting their needs through that behavior. From there, this creates more of a clean slate. And then from that, we can start training the alternative, more appropriate behaviors, the more socially acceptable behaviors, while we're counter conditioning, desensitizing, creating those more neutral responses to what they don't like and what that negative is. From there, we can also start creating, hopefully going beyond the neutral to where they actually enjoy and have a happy tail when they start seeing that thing that they don't like, whether it's the other dog in the house or the husband, the stranger, whatever it is.
So, can you give a like an example, maybe of a management strategy that you might? And again, I realize that all situations are kind of unique, but maybe one that you've a management strategy that you've recently put into place for some client.
One of my favorite things to do is doorbell training. When they hear the doorbell, they automatically run to the back bedroom, walk-in closet, whatever we define as their safe zone. So we create as soon as they hear doorbell. That sets them up where they are contained. We ensure the safety of the visitor coming through the door or collecting the package, whatever it is. And then from there, we are controlling that introduction. And then the human, the owner, the handler is able to turn that situation into a training opportunity. So they can control the level of exposure rather than the dog charging at the front door, practicing, rehearsing the behavior. You work with leash reactivity. So one of the first steps with leash reactivity is changing where you walk, changing the time of day. So they're not practicing hitting the end of the leash every single time they go for a walk. And then from there, that creates that clean slate that you can build off of.
Okay, excellent. So, another thing that uh, you and I have talked about, but I've heard a ton of other trainers that deal with aggression issues talk about this, and that is it's really important to rule out medical issues. And as a person, and this is actually a question for me, and I'm sure it will be of interest to my clients and the people who contact me as well. But really, how often are medical issues actually an underlying factor in aggression? Um, and and for those times that they are an issue, what kind of medical issues do you see that are lend themselves to aggression?
So the absolute most common medical cause of aggression tends to be pain. And I see that quite a bit. We can often catch it. It's something that can be as subtle as hesitating before they jump up on the couch. I've had several calls just recently with dogs who were involved in car accident. One phone call 2 days ago was a dog who suddenly changed their behavior after getting hit by a truck 3 months ago. And the dog just walked it off, wasn't limping. So the owner just kind of blew it off as the dog's fine. Dogs are masters at masking pain. If they're limping, if there's difficulties in their gait, and even with a very typical veterinary pain rule out, they're just looking for range of motions. They're looking for vocalizations when they're moving the leg in a certain way. Generally, we want to find a veterinarian who has a little bit more training in pain assessment. Often veterinary chiropractors, the whole more holistic vets who work with fascia injuries or laser therapies. So those are the vets that I have locally who I send my potential pain clients to. And then also there are these, I'll often send them to the general practicing vet, ask them to rule out pain. Also, there's other issues that potentially can cause behavior issues that a lot of general practicing vets will be able to spot, like medications. One of the big ones for changing brain chemistry is actually sleep disturbances and nutritional. There can be malabsorption issues or just poor diet. So we'll have the client talk to their veterinarian, make sure that there's none of those obvious big ones, and then also more potential for like neurological issues, possibly hydrocephalus or um, seizure disorders, stuff like that.
Okay. All right. So let's say that you send a dog's owner along with their dog to the vet for this rule out to rule out medical issues and, you know, underlying, medical factors. And it comes back, that there's no underlying medical issues that they can find. In that case, what are some of the other issues that can be drivers of aggression?
There can be breed history, like a border collie herding the kids type of thing. There can be genetic. Really, what we're going to be, how we're going to be hitting this, we'll consider those, the ethology aspect, and then we'll start training alternative behaviors, something that's more appropriate, like trained retreats, where they go behind the owner. We'll be working on leash walking and control. And then we will start the desensitization counter conditioning process. One of my favorite things for inter-household issues is stationing, getting them to automatically see the other dog and then automatically go to their place. Stuff
Okay.
like that.
Okay. Um, so this is a question I think that pretty much all clients are going to start developing pretty early in their interactions with you, I would imagine. I see this come to play in our like intensive leash aggression courses and all that. So I know it's a thing. Um, when you're working with an aggressive dog, how do you set a client's expectations as to what constitutes success? How do you functionally analyze whether or not you think you can actually train the dog away from this aggressive issue, or this is going to be a management for life issue? And so let me just dumb all that down into the most basic question. Can you really fix an aggressive dog, or does the owner have to consign themselves to a life of management?
Again, depends on the dog. It depends
Right.
on the severity, how long they've been practicing the behavior, how's it been reinforced. And a lot of times it's just like with humans. You can get over those past traumas, but sometimes it takes a long time to work past there. A lot of times the family is the last one to realize and notice the changes. So in the beginning, our initial session is a functional assessment. We'll look at all the problem behaviors. We'll get everyone on the same page, even if they seem completely unrelated to the primary problem. So noise phobia can contribute to that baseline stress. Also, fence fighting That's rehearsing that behavior, barking through the windows. A lot of people don't really think about this stuff. So we'll want to define all those problem behaviors. Then we'll define goals, not just what we don't want the dog to do. We want to define what we want the dog to do, what we envision that relationship to be short term, mid-term, long term. Then we'll look at the safety and management. What can we do to get them to stop practicing the behavior, rehearsing the behavior, ritualizing it, and also ensuring people and other animals don't get holes put in them in the meantime. Then we'll look at the behavior plan, what exercises we're going to be working with, what skills, what concepts and theories. I want my clients to really understand what we're going to be doing with how we're going to be changing the behavior and the concepts behind it, because this allows them to be more flexible. We'll look at, for a human or dog aggressive case, we'll look at 19 points of prognosis, everything from the size of the dog, breed, age, gender, intensity of the behavior, the manageability. We'll look at risk assessments. Are there toddlers, babies, elderly people in the house? Because this ups the ante. It really creates a higher level of risk. We'll look at owner commitment level, response to previous behavior modification attempts, training history. Do we have a long-term history with shock collars, prong collars? Because those are further withdrawals from that emotional bank account, and it takes a little bit more to overcome those previous negative associations. Also, where the humans are at. When you're living with a dog with this serious of a behavior issue, especially if it's directed towards them, each one of those negative experiences with the dog is a withdrawal from that emotional bank account. And if we have too many withdrawals from that emotional bank account, that relationship goes bankrupt. And often that can be not just even the dog side, but human side, and regaining that trust and relationship directed towards the dog from the human and family members.
Okay. Yeah, so it sounds like you have a very thorough process. And I guess, by going through this, you can sort of estimate the likelihood of success here.
Yeah, it basically gives you a clear prognosis. It puts everything on paper, so everyone's on the same page. So a lot of times, this is really what determines if the family has it in them to get to that next point and hit those goals. It also makes sure that the goals are obtainable and fair for everyone, ensures everyone's quality of life within the household, and if they can last through the process.
Okay. Which one? So that brings up two things that weren't originally on my list of questions, but one you directly mentioned, and the other I think is somewhat implied. And I'll just throw them both at you at once so you can just knock them both out. But the first one is, so as you know, in our training, we don't use shock collars and prong collars. Uh, and you and I know the reasons why, right? We've studied this stuff, and we know. As for me, I mean, I trained with a shock collar really early on, so I understand how it works, and I've seen some negative side effects from it. For example, I've seen dogs that were snake proofed with a shock collar hear a sprinkler go off in a yard and just take off
Yeah.
running across the street to get away from it.
Or
Lots
they
of stuff.
collapse on the ground.
Yeah, lots of stuff like that. But anyway, um, what is your take on the use of shock collars and prong collars as it pertains to what you specialize in, to the aggression stuff? How do you, what do you think of that?
I've seen a lot of very damaged dogs, and I've seen dogs who become safe. They went from a shy 6 month old and they get sent to a boot camp. They come back, and for pretty much they come back, we're resigning them to a life of safety and management. One in particular had to stay at the owner's parents' house out of state because they couldn't have the dog after they came back safely living in an apartment complex, in a high-rise apartment, because the dog became so dangerous afterwards due to the fallout, as you mentioned, those unintended consequences. With what I do with aggression, we don't want to suppress behaviors. We want to listen to the communication. We don't want to punish the growl out of the dog. We don't want to punish the bark out of the dog. That's suppressing the symptoms without dealing with the underlying cause. If anything, we are contributing to the underlying cause of the fear and anxiety and negative associations to what they don't like. We're making it worse. We make this person a bigger threat. With family pause, dog parent, dog toddler, dog or baby education, I'm a licensed family pause educator. We don't want to live in a state of reactive supervision where every time the baby approaches, we're yelling and screaming and making a big deal out of that approach. That becomes reactive supervision. Often we can start creating negative associations or broken trust, broken bond between the dog and baby, dog and toddler.
So, just adding a little bit onto that for the knowledge of whoever is listening to this. So, I feel like at Fetch Masters, we have developed a bit of an advanced and special skill set at dealing with leash aggression. And I can tell you, probably 75% of all the intense leash aggression cases that we get, that we work through, and that we have success with, came from either a trainer who advocated or an owner who just on their own went out and bought a shock collar to try to suppress the leash reactivity. And it only made it worse because the dogs,
Yes.
they begin to associate whatever they're looking at with that stimulus, that shock hitting them. And so yeah, I concur with you, but I want to throw that out there for sort of educational purposes. But I told you I had two questions. One was the shock collars and prong collars. Here's the other question. So once you do this functional analysis and you're looking at everything about the dog, you're looking at the owner, you're looking at past training history, how the owners respond to that, you're trying to get everybody on the same sheet of music. I almost hate to ask this, but is there a point at which euthanization becomes a recommendation? And how do you do that as a trainer? I mean, obviously it can't be your first suggestion to someone, right? I mean, I would think there's steps, but anyway, you know more about that than I do. That's not the realm I work in, but can you tell us about that?
I'm never going to say one way or the other. I'll give my feedback, and it's really the owner's decision. This is part of the reason why we do the functional assessment, is to get everything on paper, objectively, take the emotions out of it, and really see where we're at, assess where we're at. From there, I will support the owner, whatever decision they make. I will point out if there's safety or management concerns. If we can't ensure those two things, I will say we can't ensure the safety of your child in this situation. Lapses of management can sometimes happen, and that is a high consequence to deal with in that situation. Dog inter-household aggression. I have pointed out that if there's a 5-pound dog versus 215-pound dog, it doesn't take a whole lot to compromise that 5-pound dog's life. Most of the fatal interactions between dogs that I've encountered where the dog doesn't make it out has been these drastic size differences. When we're doing the functional assessment with the intra-household, we will add additional factors, prognosis of size differences, social history between the dogs. Those are specifics that we'll be dealing with. Hopefully, in a situation like that, where there's such a disparity that it is compromising safety and management, hopefully, we don't have other issues with that dog that makes that possible to rehome the dog. But if we have severe aggression issues towards humans too, and that dog has a fatal attack on their history between with another housemate, that might be a point where I'm doing a little bit more direction, where I might point out that this dog's ethically and really we can't rehome this dog at that point. And usually I'll walk the person through the process as they're processing, what about this option? What about this option? What about this option? It's a really horrible place to be in, especially when behavioral euthanasia becomes pretty much the only option.
Even before COVID-19, Fetch Masters was using distance coaching to help people around the world with hunting dog training. And at first, we weren't quite sure how well that would work out. Then when COVID-19, but it ended up working out pretty good. Then when COVID-19 started, we started using distance coaching for standard behavioral modification issues and even obedience training. And we actually found that the distance coaching sometimes, not all the time, but sometimes it's more effective than having a trainer go to someone's house. That actually surprised us quite a bit, because when we're say on Zoom or a FaceTime meeting with someone, that dog does not know we're there. We're seeing what that dog actually is, what that dog's actually doing. And I can't tell you how many times, though, with in-home training, we've been in a person's house and the person has said, well, the dog's great when you're here, but when you're gone, it does this, that, and the other. And so when we did in-home training, dealing with a lot of BMOD issues was very theoretical. With distance coaching, it's actually real time. And so there are ways, in my opinion, that distance coaching is better. But how does it apply to aggression issues? Because when we refer issues to you or clients to you, the way that you have to deal with that is through distance coaching. Are there upsides, downsides? Are there disadvantages you figured out how to overcome? Tell me a little bit more about that process.
Well, just like you said, with the general obedience, that work, we're able to transfer the skills over a lot easier. As long as my communication is clear with you, you'll be able to do it. I just found it allows the owner to understand that nuance of where their hand should be, what they're communicating with their body language. It's a lot more clear when it comes to transferring skills. With history, it takes so much stress out of the entire equation. The dog's not trying to rip the doorknob off the door to get to me, and we're not having to worry about the door flying open and me getting mauled by a dog who is extremely territorial. So there's that safety element, and it reduces the stress levels of the humans, because trying to collect a detailed history, going over processing all this difficult stuff that goes into that history, having a dog bark themselves hoarse so they're to the point of coughing, nobody wants that. And it's not forming a positive association to me. I become a threat, and probably a bigger threat because the dog had been barking for an hour and a half to the sound of my voice. So we found that with stranger danger dogs, human directed aggression, especially coming into the house, it reduces the baseline stress levels, and it allows us to transfer information more effectively and also skills, because so many of these dogs are so stressed with this intruder inside the house, they'll get to the point of not taking food. And then at that point, we're just staring at each other for an hour. We might try doing a remote with me on my phone, coaching them from my car. But at the same time, that's might as well have a better setup here where I actually have more tools to communicate remotely with those dogs. So once I start seeing people in person, I haven't been seeing people since mid-March. Once I start seeing people in person, I'm turning my program into a hybrid program, even for my local clients. So for a minimum of the first 2 to 3 sessions, we'll be working remotely. And then when it comes time to doing exposures, we can bring me in person into the mix where I act as a decoy. The main disadvantages that I've seen to working purely 100% remotely is we don't have me as a decoy. So we're trying to train a person to act as me. But with that, we can only do so much to educate that person. So they're not going to recognize those tiny little nuances before we get an outburst. There's going to be a delay where potentially they can react. So we need to take safety that much more into consideration. So we need to have those layers of safety in place so mistakes don't happen. They can't be within that close proximity. We're probably not going to get them to the point where they're directly interacting with the dog who's having the issues because of those safety concerns, that I don't want to put anyone at risk. Also, if we have a bite incident, even a scratch, even a near miss can be fatal for that dog, because that might be that last straw that the owner is saying, this isn't safe, this isn't working. So I don't want to put the dog in that. Make sure that safety and management, we're doing those exposures and bringing that, coming closer to our goals that we define.
Okay. I would think you could enlist the help of a local trainer to assist you with that too. You know, most of the trainers in the Denver area, I think, at least
That
most.
is true.
Well,
At
you
least the
may
ones that have
not.
been around for a while.
Yeah, you may not know it. That actually brings up another point, but which I'll come back to. But you know, the more established trainers here in the Denver area, you know, because you trained here before you moved to Houston. That said, there are a lot, and I mean a lot, of new trainers with very little experience around this
Yeah.
area. And, you know, you're not going to know those. So anyway, at least you have contacts with some of the
I
more
do have
experienced trainers.
plenty of contacts who, and I've
Um,
acted as decoys for a lot of those same trainers too,
right,
when they're
right.
working with their dogs.
Yep. Um, and one thing that I'd like to throw in there is, you know, it's not very profitable for you to go into someone's house and their dog just bark at you the whole time, right? I mean, we're not, a lot of
We're not going
clients,
to make,
yeah, a lot of the clients think, oh, you're a dog trainer, you know how to handle that, you know how to fix that, you're immune to that dog biting you, so here, let me just open the door without my dog on a leash because you're a trainer and this, you know, you're somehow immune, and we're not. And you know, we don't want to get bit. It's not part of our job to get bit or mauled, right? Our job is to help fix the dog while paying attention to everyone's safety, including our own. So I wanted to kind of throw that in there for educational purposes.
I consider it a failure if teeth contact me. I've only had one dog, two dogs out of thousands who have actually made any contact on skin with me. One was a tiny little bruise on my knee. The other was the dog basically got a mouthful of elbow in his mouth. And that was just me defending myself. And it was, I, every time I go to a conference and Jim Crosby, he is the international expert on fatal human dog human maulings. Every time we chat, it's basically, it always comes up. I have failed and base if the dog bites me. I did something wrong and it's not our job to get bitten.
Yeah.
And it's a complete failure on the human side if we allow that to happen. And with the behavior modification process, that again is allowing them to rehearse, ritualize that behavior, strengthen the behavior. One more time, that bite worked for the dog. And it's going to make it that much harder for us to get them past that to a place where they learn that they don't have to practice that behavior anymore in order to meet their needs.
Gotcha. Let's wrap this up. We're coming up on about 45 minutes here. Great information. Thank you so much for agreeing to help me create this content, and can't wait to get it out there. Can you tell folks how they can get a hold of you if they're interested in working with you on aggression issues remotely?
So I would first start with my website, houstondogbehavior.com. I would
We're going to
also,
put that. We'll put that in our aggression email too, so they'll have that there.
great. And then also do a search on Google for Houston Dog Behavior and Training. That's going to come up with reviews. I pride myself on those reviews. Each one of those reviews is its own story. And I always tell people, maybe you can find your story in my reviews.